For the past few weeks, we have been learning injection and infusion Cpt coding. In the first video, we have learned about chemotherapy coding. In the second video, we have learned about infusion coding. Don't worry, I will place these video links in the comment section of this video. So today we will learn injection and infusion Cpt coding IVP. So which is part 3. In this session, first we will learn definition of IVP, then we will learn CPT codes related to IVP. In order to understand IVP, we need to understand two terms. First one is IV bolus, second one is IV push, where we have separate codes for IV push. In IV bolus, physician will administer the medication in a single large dose directly into bloodstream. Most of the time, this stream run over short period of time, mostly within minutes. So then what is IV push? Here also, physician will administer the medication in small doses in very short period of time, usually in seconds. So if the physician administered medications in minutes, we will call it as IV bolus. If the physician administered the medication in seconds, we will call it as IV push. So based on CPT guidelines, if you want to code IV push, you need to check the documentation. If the physician has provided medication administration 15 minutes or less. If the physician administered 16 minutes, it will come under infusion coding. If it is 15 minutes or less, we need to call it as IV push. So if you see pictorial, so IV bolus means most of the time physician will administer medications in minutes, like approximately 5 minutes based on the drug. Okay. So if you see IV push, here physician will administer the medication within seconds. So here physician will administer same medication, minutes is IV bolus, seconds is IV push. Next we will see CPT codes related to IV push. Okay, so basically we have three codes: 96374, 96375 as well as 96376. So 96374 is single initial drug, 96375 each additional new drug, 96376 IV push performed within 30 minutes push same substance or drug. So we will check these codes in the CPT book now. So currently we are using 2025 latest version of CPT book. We need to follow this one. So here we have three codes: 96374, 96375 and 96376. 96374 intravenous push single or initial substance or drug. So basically when do we code 96374? So please mention in the comment section of this video. Okay. So next we have 96375, which is a add-on code. So intravenous push, each additional sequential intravenous push of a new substance or drug. Okay. So first IV push, for example, patient has administered Levaquin. Okay. So initially, so 96374. Okay. So after that one, patient has administered morphine. Okay. So 96375. So here, if you want to use 96375, patient must and should need to administer new drug. Okay, so that is the important guideline here. And also you can use 96375 if the patient uses the same IV access. So we have one more add-on code 96376. Okay, each additional sequential intravenous push of the same substance or drug provided in a facility. So what is the difference between 75 and 76? 75 is new drug. Okay, 76 is same substance or drug. So basically what do you understand here? If the patient performs intravenous push of Levaquin, initially we will code 96374. Okay. So if the patient administered Levaquin after 31 minutes, we will code 96376. Why means 96376 we will use if the patient administered same Levaquin. Okay. So these are the basic guidelines related to IVPs. So see the important guideline here. We can't code 96376 if the patient performs IVP within 30 minutes of the initial drug. For example, patient has administered Levaquin at 10 a.m. Okay, so that time we will code 96374. Okay, again patient has performed administration of Levaquin at 10:20 a.m. Okay, so here we can't code 96376. What is the reason? So based on CPT, if you want to code 96376, patient needs to administer the IVP after 30 minutes of the initial drug. Okay, so if you calculate 10 to 10:20, it is only 20 minutes. So we can't code 96376. Here we will code only initial code 96374, that is based on CPT guidelines. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also, if anyone looking for medical coding trainings include same day surgery coding training, IPDRG training, SCC training, CCS certification training, please send WhatsApp message. So thanks for visiting past quarter 21. Still you are confused about coding of IVPs, please mention in the comment section, and also please share this video to your friends.